Coming up on the Doctor's Hospital podcast.
The maggots, they usually physically feed on dead tissue.
Mm.
And so when they feed, they release special chemicals into the wound that break down the dead tissue.
When accuracy, efficiency, and simplicity matter, choose Doctor's Hospital Laboratory Services. We are the premier outpatient laboratory service in the Bahamas, delivering timely results you can trust. Experience the ease of testing with us. Accurate, fast, and hassle-free. Doctor's Hospital Laboratory Services, where precision meets convenience. Give us a call at 302-4759 to get started today.
Hello, everyone. My name is Eddie Russell, the Learning and Development Specialist within the GLOW Initiatives Office, the hospital's wellness solution that fosters personal and professional growth and workplace optimization. Welcome to the Doctor's Hospital podcast, where we connect public health issues to what we do within the Doctor's Hospital healthcare system. Today in studio, we have Dr. Rodlyn Malcolm, family medicine physician and wound care specialist for the Doctor's Healthcare system. And thank you so much for being with us at this hour, on this day. How are you?
I am great. Thank you for having me at this time, at this hour, with you all.
I love when the guests go with it. Thank you so much for being with us. So today we're talking about wound care, and we have a couple questions just to kind of keep the public aware of the services that we have at Doctor's Hospital and the importance of keeping these wounds healthy. I know that when we were younger, we would sit and, during the summer, we'd run around, scratch up our legs. Some of us are still, some of us still have the wounds or the scars from those playful days. But I know that within the medical healthcare system and in the medical system, we have more serious type of wounds, and I want to talk about anything to do with those today. I think I want to start with our first question, and I'm just gonna go kind of ad lib. What is a wound?
So, wound is basically any break in the skin. If we keep it simple for our listeners, it's just any break in the skin that can cause a problem, bleeding, infection, scarring. So, any break in the system, in the skin system.
And just for our listeners who are tuning in, I wanted to talk about the type of wounds that you would typically see on a daily basis or within your practice.
Okay, so that's a great question and a common question as well. Wound care covers a wide range of conditions. Specifically, in our population, we deal with a lot of our diabetic foot ulcers. This usually happens when people with diabetes, they get a small wound on their foot that doesn't heal properly due to poor circulation and nerve damage, which can cause a lot of issues. And, based on our population, Bahamas, we kind of take the prize for a lot of different things that may not be the best prize, but we pretty fat, if I should say it like that, obese, which comes with a lot of those medical conditions. So diabetes is one. Another one would be what we call poor circulation, which could lead to venous disease, venous ulcers, pressure ulcers, arterial ulcers, just to name a few. And then in addition to that, not just limited to medical conditions, but we also see wounds from post-surgical standpoint.
Right.
So we see surgical wounds that may not heal properly, burns, traumatic injuries like deep cuts, crush wounds, and then of course, infected wounds that may be a lot more tricky to manage. So those are some of the common wounds that I would see based on medical conditions or surgery post-op.
And as far as wound care is concerned, what are some of the challenges that you face in treating chronic wounds, and what can anyone do to overcome them?
So we mentioned the term chronic. Sometimes I like to use the word chronic, or I would say non-healing, or the stubborn healing wounds, like those are the ones from diabetes or poor circulation, and they can really be tricky. They don't heal as quickly and they are at higher risk for infection. And so the challenge is that sometimes our people, they don't even realize how serious a slow healing wound can be. So that's why we truly focus on managing underlying conditions,
Mhm.
keeping the wound clean, using the right dressings, using the right treatments to give the wound the best chance to heal. Hence why with my other specialty, family medicine, I concentrate on keeping the sugars control, managing nutrition,
Mhm.
managing weight loss as best as possible with the help of a nutrition specialist as well that can help us to manage these chronic wounds.
So this month is Nutrition Month, and the hospital is abuzz with all of the nutritional facts. Shout out to our nutrition dietary department for just laying out the calendar of all the events that are going to be happening this month. But in terms of nutrition, I want to ask how important is it? How important is the role in play in wound heal in the wound healing process? And are there any like I know you said sugars, but are there any other foods that you should probably stay away from if you have wounds that require or you want your wounds to heal faster?
Sure. So, nutrition, as you mentioned, is huge when
Hmm.
it comes to healing, often neglected. Your body obviously needs protein to
Hmm.
rebuild tissue, to rebuild muscle. We need vitamin C specifically to produce collagen to help with the skin cell transition. We need zinc to speed up the growth of cells to help to close the wound more quickly. And for example, if you are actively recovering from a wound, you could load up on things like eggs. The price down now, so we could probably, get some eggs,
What a craze.
chicken,
That was a couple weeks ago.
chicken, fish, leafy greens, nuts, citrus fruits, which goes back to the vitamin C content. And then, of
Hmm.
course, if you're not getting enough from your diet, you may have to cheat a little bit with some supplements like vitamin C or zinc. But of course, you should always check in with your family physician to make sure that it's safe for you to have these additional supplements on board to aid in that process.
So we're talking about wounds and them being quickly healed. What slows them down? I would say the opposite, but can you guys walk us through like what would slow down a wound's
Right,
healing process?
right. So, a lot of things. So we'll start with again the comorbids or what we call medical conditions. So diabetes, poor circulation, some kind of infection that may be unrecognized. For those who may have difficulty with their smoking habits, smoking can decrease circulation and decrease the rate of wound healing. And guess what? Even stress.
Mm,
So, if your body isn't getting sufficient oxygen and nutrients, then it's obviously going to take a longer time to repair itself, right?
mm-hmm,
So, the best way that you can stay away from these risk factors is to, again, I will always repeat, keeping the wound clean,
mm-hmm,
having a balanced diet, staying active if you're able to stay active. I know there are some limitations with some people.
mm-hmm.
If you smoke, try your best to cut back. Your body will thank you. But again, make sure that you have a family physician on board to get this advice so that you can be, assisted with your journey.
So you touched a lot on some or lifestyle choices that people may have that may possibly slow down wound care. And I want to pivot just a bit and talk about what people should look for. So for instance, you get a wound, it's relatively, you just kind of like, oh, it'll heal. Are there any colors? Are there any scents? Are there any things that one should look out for and pay very much close attention to? And would these signs then lead to the need for urgent care or just a checkup?
So generally, I feel like most people may have a little inclination that something is off.
Mhm.
Again, you have to be really keen on your medical condition. So, okay, so for someone like me or you, Eddie, generally healthy, you sustain a laceration, depending on the size of the laceration. Obviously, you could open it up and see that it's deep.
Mhm.
You're probably not going to sit there and put salt water on it because, we like to put salt water on everything, which
Some
is the
people
wrong thing to
might,
do.
Dr.
Right.
Malcolm, some people might.
So
Just like,
salt water peroxide, please, my people, hold off on the peroxide and the salt water. So it just based on the deepness, how long it's bleeding for. If
Mhm.
you're able to hold off on the bleeding, of course, you would just seek urgent care attention as soon as possible. Or if you have a good relationship with your physician, you can give them a call, send them some pictures to get some advice. I always recommend if you just don't feel comfortable about something, how it looks, how it smells, if it has an odor, if it's increasingly painful, it looks
Mhm.
more red,
Mhm.
looks angry,
Mhm.
again,
Aggressive
it's
wounds.
bleeding, right? Then you won't just sit there and just look at it and maybe you just seek medical attention. And you could seek your primary care attention first and you could escalate from there. But if you're
Okay.
not sure, just always call. That's my best advice.
All right. And how can they reach you? We're going to plug this in the middle and at the end.
So currently, that would be every Tuesday at our Centerville location. You can find me there from 9 a.m. to 5 p.m., specifically doing wound care of all types, surgical, medical causes. And like I said, every Tuesday, Centerville downstairs. And you could call us at 302-3250 or 302-3271.
All right. We're in studio today with Dr. Rodlyn Malcolm, family medicine physician and wound care specialist. We'll be back after this commercial break.
Are you ready to transform your relationship with nutrition? Doctors Hospital's clinical nutrition services are your first step towards a healthier lifestyle. Let us shift your knowledge of what and how to eat for a vibrant, energized you. Visit us today and discover a new world of delicious, nutritious choices. Doctors Hospital's clinical nutrition, where every bite brings you closer to wellness. Ask your doctor for a referral today or call 302-4600 extension food for more information.
Welcome back to the Doctor's Hospital podcast. We are here with Dr. Rodlyn Malcolm, family medicine physician and wound care specialist within the Doctor's Hospital healthcare system. And today we're talking about wound care. I wanted to ask this question. Can you explain the role of wound dressing and how do different types of dressing impact healing? Because I know that sometimes, you know, we some people may think that they know about putting a band-aid on it and that they call it that, and that's just it. But what is the importance of a wound dressing and making sure that you have the correct kind in relation to its impact of to healing?
Okay, great. So important that you mentioned the Band-Aid because Band-Aid, they are considered dressing. So of course, we just need to know when to use a Band-Aid and when not to use a Band-Aid. But there are
Right.
so many dressings available to us. Wound dressings, they do way more than just cover up a cut.
Mm-hmm.
They actually protect the wound from bacteria. They help to control the moisture because if it's too dry or too wet, this can also slow the process of healing. And sometimes we have little fancy dressings that actually have medicine built into the dressing so that when
Mm,
you apply it to the wound, it actually does, double the work.
right.
And so, therefore, picking the right dressing is kind of like choosing the right gear for the job. It makes a big difference in how well the wound actually healed. So it all depends on your clinical examination, the presentation, and what's available to you in your institution.
I have a question that's not that we didn't discuss, and I hope you don't whip me for this one. I'm very interested in wound care and I love the process of it. And I saw as I go through my YouTube little holes, I saw that there is I think it's called maggot therapy. What is the
Hmm.
proper name for it? Is that it?
I mean, you could call it that, maggot therapy.
Could you explain that? And do we have that service here at Doctor's Hospital?
I am not aware of any maggot therapy service. But if you want
Because-
to know how it works,
yeah.
the maggots, they usually physically feed on dead tissue.
Mm,
And so when they feed, they release special chemicals into the wound that break down the dead tissue, leaving the healthy tissue.
Mm.
And so they digest that, and it's easier to clean the wound, and you leave a lot of healthy tissue behind. And it's not just any maggot, um, by the way.
Mhm.
So they're actually specially cultivated in labs, to have proper selection for dead tissue versus healthy tissue. So they help in faster wound debridement, help to stimulate granulation tissue, and also help with wound healing. Unfortunately, sometimes when you have really, really bad wounds, you can see maggots in the wound when they
Mhm.
present,
Mhm.
and they may be doing their thing, doing their job. But to say as a medical service being provided, I am not aware of that currently happening locally.
Okay. And you think, and I'm just gonna end this right now. Do you think there's a need for it, or is it are we've not reached that level of wound care negligence as yet
I don't think, I'm not sure if we're that open
to that
to
type of
that.
therapy?
Right, not
Right,
not
right.
at this point. Extenuating circumstances can really open people's eyes
Mm-hmm.
to being offered that kind of therapy, and there are people who have it, especially abroad. There's a lot of research on it, but right now I don't know if we're open to that, but it's an interesting question.
Yeah, I
It's a
think.
consideration.
Yeah, I think we all ought to consider all of the variables, especially when we are trying to provide the best healthcare experience for all of our patients. Going back to wound care and the dressing of it, what are the risks of improper wound care, and how and what long-term complications can arise from a neglecting a wound?
So neglecting anything is not really a good idea. So
Don't
imagine,
recommend. Would not
so
recommend.
imagine ignoring a wound. So obviously, if you don't take care of it properly, it can get infected. And we always mention the word infection, but it's very serious. If
Mm-hmm.
you have your wound being infected, that's what we call a local infection. So imagine if that infection spread to your bloodstream, and it becomes a lot more serious, like sepsis,
Mm-hmm.
which is life-threatening. That requires a long-term hospitalization stay. You can have a lot of tissue damage. You could even get to the point of amputation. For people with diabetes, of course, a small wound can be a major issue. It could lead to loss of limb, loss of life.
Mm-hmm.
So the bottom line is you just have to take it seriously, even if it seems like it's not a big deal. Consult your physician, consult somebody in the medical field, get an opinion, and take it as it goes.
I like to say to everybody who's listening and those who you're going to share it to, you are a big deal. And it's very important that you take care of yourself. One of the things that we talk about often on this podcast is self care, making sure that you take care of yourself. If you see something, say something to someone or your physician. Um, we talked about lifestyle factors such as smoking, diabetes, and mobility issues, and how they impact wound healing. What strategies do you recommend to manage these challenges or any other kind of challenges that people find themselves having when it comes to wound care? I also I remember when I was in the clinical space, I remember kind of cross training in wound care, and I remember this gentleman being absolutely stubborn, not wanting to come and get his wound care dressed. But he was so active, and the longer he stayed away, I think somebody was saying that every time he stays away for too long, like he loses a toe. And to me, I thought,
Mhm.
why wouldn't you take care of yourself?
Mhm.
But what sort of lifestyle choices should people adopt, really? Not so much, we know what the negative ones are, but what sort of lifestyle choices should they adopt?
Right, and it's so important that you mentioned that we should also focus on is not just the physical aspect of the client, is
Mhm.
also the psychological stress and impact that comes with living with medical conditions, and it basically changing their life. So
Mhm.
now they have to adopt a new way of living, which can cause a lot of distress, significant distress, and makes
Exactly.
them a lot less likely to want to continue care. So,
Mhm.
like I always say, my wound care people, they special and they special in their own way.
Mhm.
So you have to handle them with due diligence and due care, as we always do, because
Kid
your health is
gloves.
worth it, right?
Mhm. Trusted
So
best care now.
basically, that's what I mean. So the best thing you can do is just try your best to stay on top of your health. Something simple as making sure that you get your annual physical exams. Let's just start there.
Mhm.
Getting your wellness checkup, getting your examinations, your blood works. If you have poor habits, trying your best to, for example, smoking. I'm going to always bring up smoking,
Bring it up.
right? Trying your best to quit or limit your intake as best as possible. Managing your blood sugar, people, managing the blood sugars. Seek your medical advice because if your sugars are not controlled, what is the point of trying to heal your wound? We
Mhm.
need the underlying conditions controlled. So, how can we manage our blood sugar? That's basically adjusting our diets, cutting back on the carbs, managing the amount of sweet beverages we intake. Coke sodas, you all love with the bottle and the cans, all the Coke
Mhm.
sodas, the small things that you can do to change. Move. Let's get moving. How
Mhm.
about activity? So trying your best to make movements, walking, jogging, making changes in your lifestyle, shifting positions. If you are in a work environment where you're sitting for long periods, try your best to stand up, move around, exercise that muscle about 30, at least 30 minutes, 15 minutes if you can.
Mhm.
Um, Try your best to get active. So it's really small. I mean, it's so simple, it's hard, right?
Right.
That the simple things can make a huge impact on your lifestyle, which can decrease your risk of developing complications that can lead to ulcers and improper wound healing.
I think it's important for people to understand that every little step that you take to better yourself betters yourself.
Yeah,
It's so
that's
simple.
yes,
It's
yes,
simple. It's simple, but I think what one of the things that we kind of like, oh, you can always do it, it's not as I think it's psychologically, like you said and you touched on earlier, psychologically you have to get into the mind frame of wanting to be healed.
yes,
Um Mentally you have to get into the minefield of giving the effort and pushing past those initial feelings of um reluctance or apprehension when it comes to feeling or doing the thing that we need or you need or anyone needs to just heal themselves. And I think
yes.
when you have something as serious as a wound that essentially is open to the world and all of the little
Mm-hmm,
germs that could possibly get enter your body. The break in the skin is as the largest organ, like is
mm-hmm.
that break in skin exposes you. So the goal is take care of yourself so that your skin can come back to what it was, and you can stay protected. Um, I
Yes.
I want to talk about patients. For patients undergoing surgery, what are the best practices for post-operative wound care to reduce the risk of complications?
So first and foremost, listen to your surgeon.
Mm-hmm.
So you get very clear post-op instructions, I'm sure, from your surgery. So I know they mentioned we can say this word again, keeping the wound clean and dry
Mm-hmm.
is priority number one. Okay, and dry in the sense of making sure that it's not too moist to cause any risk for infections. Follow your doctor's instructions. Don't overdo it with physical activity. Again, we mentioned the diet to support the wound healing. Pay attention to your wound. Be keen on noticing any signs of redness, swelling, any oozing that really shouldn't be present. If you notice any of these signs, immediately call your physician. The sooner you catch the problem, the easier it is to actually correct and fix. So you get post-operative instructions, you follow them. Anything out of the ordinary, you just give your medical practitioner a call.
I have another question. For anyone with a wound, what's a kind of rule of thumb to follow in terms of having your bandages changed, your dressings changed?
Okay, so when it comes to the dressings, The things that you want to look out for is it really soaked?
Mm-hmm.
Is it super moist? If you notice that it's not really adherent to the skin, it's coming loose. All of those things you want to look out for because, again, we mentioned if a wound is too moist, it increases your risk of infection. If it's too dry, then it doesn't heal properly. So, of course, if you see that your bandage is soaking through with either blood or moist fluid, then you want to make sure you visit your dressing care. Um, Area so that you can get that changed as soon as possible. And maybe the choice in dressing may need to be adjusted as well. Sometimes the type of dressings vary
Mm-hmm.
based on the amount of fluid that may be present. You may need dressings that can handle more fluid. You may need dressings that can handle less fluid, a larger, a smaller, some dressings to help fill an open space. So it all varies on the client's presentation and type of wound.
Okay. Thank you so much for those tips and things, indications to look out for. We're in studio today with Dr. Rodlyn Malcolm, family medicine physician and wound care specialist. She can be reached at the wound care clinic on Tuesdays at Centerville Medical Center from 9 a.m. to 5 p.m. Would you mind giving us that number again, please?
The number would be 302-3250, or you can reach us at 302-3271.
And a purposeful plug. If you sign up for LAMP, you're able to get your sprains, and minor burns tended to by our wound care specialists within the plan. And also, as it is March is Nutrition Month. Members are awarded 3 nutritional consultations that are covered 100% per calendar year within the Lump Ultimate program, and services are rendered by your registered dietitian. Dr. Rodlyn Michael, thank you so much for being with us today. Is there anything else you would like for anybody else to know about your services?
No, I'm just going to put the plug in there and make sure everybody has a family medicine physician to tend to your medical conditions as well. Keep up with your annual physical exams. Those are the things that will help with prevention of a lot
Hmm.
of our complications.
And remember, prevention is better than cure.
Yes, sir.
On behalf of my producer, Gally, thank you so much for being with us. My name is Eddie Russell, the Learning and Development Specialist within the GLOW office, our hospital's wellness solution. Thank you so much for listening to the Doctor's Hospital podcast. Take care.
Doctor's Hospital Specialist Clinic is where trusted and best care meets consistency and dedication. Let our expert specialists take you on a healthcare journey where warmth, compassion, and your well-being come first. From diagnosis to prescription, we are with you every step of the way, ensuring your peace of mind. Visit us today at Centerville Medical Center, Collins Avenue and 6th Terrace, and discover quality, compassionate healthcare at Doctor's Hospital Specialist Clinic.